So the CT scan that she had done in June showed a lot of abnormalities throughout the spine. Not so much in the neck, but more the thoracic spine and the lumbar spine. They did a biopsy. They said, well, it's consistent with breast cancer. And if that's spread, typically surgery is not the right answer. You know,
Right.
surgery is typically something to think of if it's only in one location.
Right.
So she had radiation treatment, and
Yes,
radiation
yeah.
treatment can be quite effective for pain, for tumor pain. The only thing is, it doesn't necessarily make the bone stronger. It can make it stronger because it kills tumor cells, and then the bone gets a little stronger. But in your wife's case, she's actually fractured 2 vertebrae.
She fractured?
Yes, and so I'm going to show you a picture of that in a moment. So she fractured number 11, T11, which is a little bit below the bra strap in women. And then she fractured L2. They're not that far apart. And what the fracture does is it makes the spine relatively less stable. There's more movement than normal. Just like if you break your forearm, there's abnormal movement there. And that abnormal movement is typically hard to control. She has a lot of pain meds, and if she lays still, she's okay. But if she walks, it's still very painful.
Yeah,
what
that's
she
why she's
tells
holding
me.
it, you know.
Yeah.
She's trying to hold up.
Yeah, T11 is about here, L2 is about here. And that's sort of where she is tender at the moment. Although she said, my pain seems to go up and down, but that seems to be where her tenderness is when she rolled on her side.
That's what I thought too. I think it's not the bone, but I'm thinking about that tissue right there is weakening.
Yeah,
That's the one thing I was thinking of. Okay.
right.
From day one, before they do anything else, that's what I assume. And according to what you said, that got to be a tissue, right?
Right.
Yeah. Okay. That's what I thought.
So, we'll make it a little better. So, make the room a little darker so you can see it better. So, this is the CT scan in June. And the CT scan shows there are holes in the bone, and a lot of different places where
So
there's
all these little black dot here is holes.
those black dots shouldn't be there.
Just push the silent button, the orange one.
Okay, thank you.
So this is the tailbone. That's 5, 4, 3, 2, 1, 12, 11, and 11. You can see that there was quite a big hole. A lot of the bone is replaced. So probably the radiation treatment killed a lot of the tumor cells, but it didn't make the bone stronger. It does in the long term, but not in the short term.
Right.
And this is what T11 looks like now. So you can see normal shape bone, normal shape bone. This is not normal shape, and it's putting some pressure on the spinal cord.
That's why I talk about the feel for here, feel the lump.
Yeah.
Yeah.
So, and then this one is also broken. That's L2. You can see that a little better. So the lumbar spine, this is the tailbone, 5, 4, 3, 2, number 2. That's broken. But no pressure, enough room for the spinal cord. Here, this and this are the same one. So this is T11. You have 12 bones in your thoracic spine. And there is some pressure on the spinal cord. It seems to be working okay. She has some radiating pain here,
Right.
which could be coming from here.
Oh, it could be coming from that.
Yes, but it doesn't seem to, everything is moving strong. So she has enough strength. So, but the problem is that if you have a fracture, it often heals. But if you have a fracture because the bone is replaced by tumor, it doesn't heal very predictable. So, because she's having, she can't really do much at this point, and because there is these 2 fractures, I think she would benefit from making her spine a bit more stable. That's an operation. That's something that I would do.
Okay.
And we make it more stable by putting some screws into good bone above and into bone below, and then connect it with rods. The only thing is, her good bone is not all that good either. So this is 2 months ago, or not quite, but about 7 weeks ago. And since then things have changed. So the reason for getting a new CT scan is that
You want to see what the movement is
I want to
from
see
the past, from that month till now.
I want to see whether the bone is good enough to put in the screws. Because if she has a lot more bone loss, putting in screws may not be the right thing to do.
Right.
Yeah. But if I can do it and we look like we get good fixation, the remaining bone is strong enough, I think it will allow her to walk a lot easier, to walk better. It doesn't really change anything in the prognosis because she still has tumor. She has some discomfort here in the sternum, and I think that's related to that also. So she will still need to be followed by Dr. Blau, and she may need a little extra radiation, except in the back she's had pretty much what we can give her. If you give too much radiation, it kills also spinal cord cells, so we don't want that.
Right.
So I think surgery has a chance of helping her with her pain, so she has less pain. Safeguard the spinal cord so that everything continues to work. Those are the main things. But it's not, whether it's not necessarily going to make her live much longer or live shorter or something like that. It won't affect, you still have tumor in other areas of the spine.
So, okay, bottom line, on what you see here, on your judgment, on your expertise, how long?
Oh, that I can't really tell because, and not because I don't want to tell, but we just really don't know. Because breast cancer sometimes responds very well to medications. And that's an appropriate question. Oftentimes, a lot of doctors can't tell, but if anybody can give you a better idea, it would probably be Dr. Blau.
Right. See, that's the thing that I like to know. I mean, I might have a straight answer, if you say about 6 a year, 2 years from now, but we will try to do whatever we can to get it right, to get it fixed right.
Yeah.
I'll be blessed to you guys.
Right.
But
'Cause that's
on your top of the point, that as far as you can go, I can't go any further.
right.
If I keep doing it, it's gonna hurt her more. So
Right. Yeah.
that I do understand.
Yeah. So the goal of the surgery is to.
Yes.
Yeah.
Yeah.
Yes, please. Bring it in. She's just out for a CT scan,
Okay,
so.
Yeah.
I'll just set it up on the table for now.
Yeah,
Sorry.
that's
Put it
fine.
right there.
Thank you. Sorry, didn't mean to ignore you.
Just gotta push things forward.
Okay.
It's all right.
So breast cancer is a little unusual. Some tumors we know are bad and go fast. Some breast cancers respond really well to treatment, and sometimes people have breast cancer in the spine and live for 10 years, sometimes shorter.
My neighbor.
But it's difficult to predict, and it depends sometimes on the type of tumor. Go ahead, your neighbor?
Yeah, my neighbor's sisters. They care her. Okay, for the first year, everything was. She feel fine.
Yeah.
She lived to 5 years. Then she
Yeah.
passed on.
Okay.
Yeah.
Yes, and I guess what I meant to say is the surgery will not change that. It will be more
Surgery cannot
determined.
change anything.
It will be more determined by if she has involvement of the liver or something like that. I don't think there's evidence of that. So that's
That's
so-
a good sign, though, for one thing.
yeah.
Yeah.
Okay.
Okay.
So at this point in time, we're sort of set to do this tomorrow at 10 or 10:30. It's a big operation because it will probably mean putting screws in at least from number 11, probably number 8 down to number 3. So in your case, it'd be sort of from here to here. She is a little anemic already, and that's not unusual if you have tumor. So she may well need a blood transfusion. Is that a concern for you?
Blood transfusion.
Yeah. It's blood is checked very thoroughly for bad things like AIDS or hepatitis. So as a surgeon, I'm not too worried about it. I don't think she wouldn't need it necessarily before the surgery, but she may need it afterwards because she's already a little low in her red blood cells.
Okay, maybe you can check my blood and her blood to see if
Oh, we
it's
have-
HIV, you know what I mean?
We have blood from that's an exact type, you know. You're,
Yeah, I know.
you're close, but your blood is probably not the right type for her. So it needs to be ready and yeah. So I will be able to compare the scans, and then I expect that it's probably going to be relatively stable. But that's what I want to find out.
Okay.
Because the reason I expect that is because it's only 7 weeks since she had this. But if you're going to do surgery, it's better to know than to
Yeah.
find out, oh, this bone is not good enough.
Right.
So I'm an orthopedic spine surgeon. I work in this hospital. It's an operation. I do the sort of surgery I do commonly, not that commonly for tumor, but maybe for tumors that, 10 times in a year or so. So not uncommon. But it's not that dissimilar from surgery that we do for scoliosis to straighten the spine.
Yeah. Yeah, my sister was trying to be a doctor, but she quit on that. Then we have a niece that is learning how to be a doctor.
Yeah. Are you from Vientiane too?
Yeah.
Oh.
Yeah.
So this is normal cross section of the spinal cord. And if you go down here, you can see there's either tumor or fracture cells in the spine, but the spinal cord itself still looks normal. And then below, it looks normal also.
So if the spinal cord got ripped, that will paralyze her, right?
Yes, if there's too much pressure on it, and it's not too much because everything is functioning, but by doing this surgery, we can make it a little safer for the spine.
Okay.
But it's an operation, and she has had radiation treatment, which affects the tissues. So she has a somewhat increased risk of infection, for example. Okay, I think still it's small enough, and you have to always weigh the risks and benefits. Hello.
Come on in.
She back already? That was quick.
I didn't even go outside yet.
Yeah. Well, I did talk to her about the surgery. I showed her these pictures also.
Yeah.
And
So now I do understand more.
yeah.
Yeah.
And,
You good?
well, you must have told them hurry up. Huh? They just brought your food.
Yeah.
Yeah.
Thank you.
Okay, I gotta go do a little bit more work, and I will be in tomorrow to see you tomorrow morning also. But 10:30 is about the time we'll go to the operating room.
Cool.
Okay.
Thank you very much.
Glad we were able to
Appreciate
meet.
it.
I'm going to look at the pictures a little bit. I expect it won't look that much different, but we needed to have that information before. Okay?
Okay.
Thank you.
Thank you very much, sir.
You're welcome.